Hi everyone, this is Dr. Stephanie Camaglia Reznick. I'm a board-certified internist and one of the doctors on call available through Oscar. In today's segment on COVID-19, also known as the novel coronavirus, I'm going to be discussing some practical tips on how to stay safe during the pandemic, especially if you live in a crowded or multi-generational household, since it can be hard to follow the routine guidance provided. Sometimes the guidance simply isn't practical. For instance, it states that if somebody in the household is high risk for COVID-19 complications, typically due to their age or past medical history, that everyone in the house act as if they're high risk. But everyone in the household can't stay isolated. Typically, at least one person needs to go to work and someone needs to go out to get the groceries and do other essential errands. So what do? Try to designate just one or two people in the household to be the people that consistently leave the house to do these items. Those people should wear a mask when they leave the home and try to avoid crowds if at all possible. Keeping a safe distance, about 6 feet from others, is also ideal if possible. Try to avoid using public transportation. I know that's not always possible, and I'll have an entire segment dedicated on ways to safely use public transportation. But for now, the key takeaways are wear a mask and keep your distance. When you get home, try to wash your hands as soon as you get home. Or when you get to work, try to wash your hands as soon as you get to work. This will help to decrease the amount of virus you're carrying around on your hands. Another helpful tip that the CDC has put out is that if somebody in the household were to get sick with possible or definite COVID-19, you should try to isolate from that individual. That's not always possible. So what do? Well, first, I want you to remember, because this is a high-risk exposure, if at all possible, you're supposed to quarantine yourself for 14 days from the last day of exposure, because you might be pre-symptomatic or asymptomatic and pass the infection to others. Other guidance is for that sick person to be in a separate bedroom and use a separate bathroom from everyone else in the household. But again, that's not always practical. If you need to share a bedroom with somebody who's sick, try to sleep in separate beds if possible. If not, sleep head to toe so you're not breathing in each other's faces all night. Try to keep a window open and a fan going to keep the air circulating well. You can use a big blanket or thick bedspread to form a physical barrier between the two of you in bed. If you're sharing a bathroom with somebody who's sick, if at all possible, the sick person should disinfect high-touch areas after they use the bathroom. Again, this isn't always possible as the sick person is just that, sick and not feeling up to cleaning. In that case, designate a person in the household to clean the bathroom after the sick individual has used the bathroom. Try to take some time after the sick person has been in the bathroom before going in there to clean or use the bathroom. Again, a window or fan for air circulation can be very helpful. Of course, wear gloves while disinfecting any of these high-touch areas. Additionally, a sick person should not be taking care of other members of the household. That means they shouldn't be preparing food for others or even eating with others in the household. Try to designate one person to take care of the sick individual, and that can include cleaning the bathroom after them, and another individual to take care of those who are not sick in the household. I hope you found these tips helpful and practical. If you have any questions, please leave them below, and I'll see you next time.